Hi, my name is Ricky Danner, and I'm the president of our local county hospital. I'm here to discuss the outbreak of whooping cough and explain to you what whooping cough is and how we're going to treat it. And I'll talk about the incubation period and the infectious period. I'll give a clinical description, how we will diagnose it, and how we will treat it, and how we're going to deal with the outbreak and contain the disease. What is whooping cough? Whooping cough is also called pertussis. It is a highly contagious respiratory tract infection. In many people, it's marked by a severe hacking cough, followed by a high-pitched intake of breath that sounds like whoop. I will show you a short video on this next slide, what it sounds like. It's a terrible sound. If you're dealing with this, please come in. The incubation period is on average 7 to 10 days with a range of 5 to 21 days. And some symptoms that you may notice are runny nose, nasal congestion, red, watery eyes, a fever, and a cough. And the infectious period is during the first 3 weeks after the onset of the cough, and that can have signs and symptoms that are worsened. Thick mucus accumulates inside your airways, causing uncontrollable coughing. Severe and prolonged coughing attacks may provoke vomiting, result in a red or blue face, cause extreme fatigue, and end with a high-pitched whoop second during the next breath of air. Infants and young children are most vulnerable, and I like to also say that even elderly people are vulnerable as well because their immune systems probably aren't up to par as younger people. A clinical description is when you should come see a doctor. Follow your early symptoms and then the second stage symptoms. If you're going beyond that, you need to come to the doctor. If you're vomiting, turning red or blue, if you seem to be struggling to breathe or have noticeable pauses in breathing, and if when you inhale, if there's a whooping sound, come to us. Young children may also seem as though they are choking or turning blue when they have a bout of coughing. Definitely come in then. How are we going to deal with the outbreak? We will do nasal and throat swabs, blood tests, and x-rays if need to be. Then when we do the swab, we'll take a swab or a suction sample from the area where the nose and throat meet. The sample is then checked for evidence of the presence of whooping cough bacteria. For blood tests, a blood sample may be drawn and sent to the lab to check the white blood cell count. If your white blood cell counts are high, that means that you have an infection going on, and it could be whooping cough. And if we really think it needs to be taken care of, we'll be looking at x-rays to make sure that there's no fluid in the lungs that can cause pneumonia that will complicate the whooping cough and other respiratory infections. The treatment that we'll be using is antibiotics, masks, hand soap. Most cases of pertussis are occurring and spreading through our community. Antibiotics may prevent pertussis disease if given before symptoms begin. However, there are no data showing that widespread of the post-exposure antimicrobial prophylaxis among contacts of people with pertussis works well to control or limit the size of pertussis outbreaks. But another important consideration is the overuse of antibiotics. So CDC is engaged in actively promoting the appropriate use of antibiotics among healthcare professionals and patients. It's to help people at high risk of developing a serious case of pertussis and to people who will have close contact with those at high risk of developing a serious case of pertussis, such as young babies and, again, vulnerable or elderly adults. We're going to be handing out masks. Wear masks. Cover your mouth when you're going to cough and wash your hands. Wash your hands. We're going to contain the disease by getting plenty of rest, drinking plenty of fluids, eating smaller meals. We're going to keep reduce the exposure to people with pertussis, encourage timely medical evaluation, and we're going to treat the cases as soon as you come in. And we'll promote the administration of antibiotics to high-risk close contacts. Vaccinations, if you haven't had them, definitely it's important to get them. To prevent pertussis, the vaccination consists of a series of 5 injections typically given to children at ages 2 months, 4 months, 6 months, 15 to 18 months, and 4 to 6 months. Booster shots are then given to adolescents and adults and pregnant women, usually between the weeks of 27 and 36 weeks of gestation, to help protect the infant as well. In conclusion, we want you to come in. You need to come in and get treated if you're experiencing any of these symptoms, especially if you hear that whooping and you're having trouble breathing. You need to get in right away so we can get it treated. We'll be keeping young children and elderly adults in overnight at least, if not longer, to monitor their respiratory problems if they have any. And we'll send the rest of you home to get sleep and rest and drink plenty of fluids. Make sure you're in clean air and prevent the transmission by washing your hands.